Are you having knee pain or been told that you may need a knee replacement? Well, before you schedule that surgery, you're going to want to hear what our next guest has to share. A new and promising therapy using stem cell injections is changing the lives of thousands of patients without the risks involved with surgery. Dr. Parker in today to talk about the benefits of stem cell therapy when it comes to knee pain. You know, a lot of people have to have knee surgery nowadays. It kind of seems like it's just a given, right? A foregone conclusion that you're going to have it. And there are some risks involved, so people might be a little leery of it, right?
Yeah, absolutely. You know, we do hear about it so much more. It's like, I hear about it all the time. Well, you're eventually going to have knee surgery. You're almost bone on bone or knee or knee. And of course, we treat patients and see a lot of that come in, but it just is so common. But there are a lot of risks involved. Some patients are old enough now that they're telling them, well, because of heart conditions or other issues, you're not a good candidate in the first place for surgery in general. They're going to just have to learn to suffer with what's going on. Or some people just don't want surgery because now we're seeing more, especially when you're putting in an appliance like the knee, replacing the knee, we're seeing a greater response as far as infections. A lot of these really terrible infections that we can't get rid of that come from hospital and surgery and type issues. And then blood clotting. I had a patient that had a very simple procedure, just a normal, a real simple scope, and actually developed a blood clot and passed away from that several years ago. And so there's a lot of concern to that. We think of it being routine, but there's a lot of statistics that show a lot of issues with that.
So how do stem cells work then?
Well, stem cells work, the model for most of our medicine is what we call a degenerative model. We're going to take a live knee, take it out, put in an apparatus to replace that, rather than using the natural healing capabilities that our body has. That's what regenerative medicine is about. That's what stem cells are about. Stem cells actually guide in the healing process throughout our whole body. The problem is, as we get older, we just have less and less stem cells, so we heal slower and slower. And we don't have them concentrated in certain areas. And so by using stem cells, we actually will inject into joints, and specifically we're talking about the knee today, but it could be any joint, it could be low back, it could be hip, it could be shoulder, but they really are fantastic, especially for knee pain. We inject those stem cells directly into the knee. Those stem cells, they replace each other, they clone very quickly, and so they will begin to make more stem cells, and then those cells can become cartilage. Those stem cells can become help replace the meniscus that's damaged, or help to replace tissue in the area, and so it actually regenerates from internally the normal healing process without having to take in external factors really to try and do it.
Super interesting. So effective, you would say, huh?
They're actually very effective. The research has been just tremendous on what they're doing. We actually saw some research just came out yesterday about the effects on a paraplegic on the spinal cord. They're up and walking and having effects because it was able to repair some of the damage to the nervous system and the spinal cord. So every single day we hear great things about it. Our patients are having phenomenal results with it. You used to have to go out of the country to do it. You'd hear about people going to Panama or people going over to Germany to get it done. And now a lot of people here in the United States been going to Florida. We now have it available right here in Amarillo. You don't have to travel to go get that done. And you can actually get the procedure done here. No downtime to it like there is for a surgery. No rehab time to it like there is for a surgery. And then it's just over the next 3, 6, 9 months, the body just continues to get better and better as those cells continue to multiply and heal up the knee. So it's pretty amazing.
Really interesting stuff for sure. Okay, so people have questions, I'm sure. They're listening. They want to know more. How do they get to know more?
Absolutely. The best way we actually do seminars on the stem cells because there's so many questions and there's so many different things people want to know about it, where the stem cells come from, how do we use them, how does it all work. So we actually have seminar. We'll have one coming up. If they just contact the office and let them know they're interested in it, we'll make sure and get them scheduled for the first available seminar that'll be coming up, and then we can answer all their questions, and hopefully they get all the information they need.
Sounds like a plan, and we'll put that information on myhighplains.com. Doc, as always, really interesting. Lots of research being done into this right now, so it's a very interesting field. We appreciate you coming in.
You bet. Thank you,
All right,
Megan.
stick around. We'll be right back after this.